High blood pressure, also known as hypertension, is a silent threat that has killed over 1.5 billion people worldwide. And it is silent because we call it silent threatening disease because you might not even know you have it until it has gotten to a very high level before you will notice it. So in today's video, I'm going to be teaching you what is high blood pressure, the probable cause, and how you can deal with it. Please, you permit me for any noise that you might be hearing in today's video, because if you're a mother here, you really relate. I've been trying to shoot this video since morning, but my little baby will not allow me to shoot. And after now, her siblings will also come back from school. She has just managed to sleep, but now there is another noise coming from one compound there. But please, I will crave your indulgence. Forgive me and pardon me for the noise that you might be hearing in this video. Just listen while you grab the important lesson that you're to learn from today's video. So let's dive in. So let's start by knowing what is high blood pressure. What is high blood pressure? High blood pressure is when the force of blood flowing against the walls of your artery are very strong, and this stays for a very long time. Then it causes high blood pressure. Normal blood pressure ranges from 120/80 mmHg, but when the reading is consistently 130/80, then there should be a sign for worry, because this might be the first stage of high blood pressure. So why do you have to worry? You have to worry because high blood pressure is a health condition that has to be taken very serious, because it can lead to heart disease, kidney failure, and vision loss. And this should be taken very seriously, because you might not even know you have it until it has eaten deep. That is why it is called a silent threat disease, because it does not come announced. My little daughter is still disturbing me in this video, but I just have to drop this important video here. Please permit me, I'm really sorry about it, but I need to drop this important, because I've been seeing questions, I've been seeing worries about this topic, so I decided to come and drop it today, and this is the only time I have to drop this. So now that you've know what high blood pressure is, we are now going to talk about the primary cause of high blood pressure. Number one reason why you can have high blood pressure is poor dieting. There are a lot of you that like taking uncooked food when you're pregnant, uncooked food, salty food, and too much sugar. Some of you, if you drink cup of tea, you add like 4-5 cubes of sugar. If when they serve you food, when food is ready and they serve you food, you still tell them to bring extra salt. You add the salt in the food you want to eat. So if you've been practicing this, just know that you're calling for high blood pressure. So you might want to avoid this habit that you've been putting up. Number two is lack of physical exercise. Science has proven that those who do not engage constantly in exercise like running, swimming, walking are prone to have this high blood pressure. So it is advised that you start your physical exercise at a very young age, so that as you're growing, even in pregnancy, you will not notice this high blood pressure. Number three reason why someone might have high blood pressure in pregnancy is obesity. Yes, when one is fat, when you're of the bigger size, you can be prone to having high blood pressure, because excess weight strains your heart and your blood vessels. Another cause of high blood pressure is smoking and drinking of alcohol. Yes, smoking and drinking of alcohol can be very harmful to your body, and alcohol and cigarettes can damage your arteries over time. Another cause of high blood pressure is chronic stress. When you're always stressed, you're prone to hearing bad news, you don't keep a positive mindset. At the hearing of any little news or something, it will just spike you up. So another cause of this hypertension is chronic stress. You might want to have enough rest when you're pregnant. Is another way to reduce high blood pressure in pregnancy. Another cause of high blood pressure is family history. There are some people that it is not because of them, it's not because of what they ate, it's not because they lack exercise or something, but it's genetic. You might have your grandmother who you do not even know but had trace of this high blood pressure, then it can be transferred to you. So another cause of high blood pressure is case of history. Genetic factor can also make you to have high blood pressure. Maybe your mother, your father, your grandma, your grandfather, your grandma, your mother, your father had high blood pressure. So there is every tendency that it can be transferred to you. There are also other health conditions that can lead to high blood pressure. If you have this health condition before you got pregnant, it can also lead to high blood pressure. Health condition like heart disease, kidney failure. So most time the cause of this high blood pressure is not just because as a result of one of these factors that I've mentioned. It could be as a combination of these different factors that I mentioned. So either one, two, or three of these can be joined together to make one to have high blood pressure in pregnancy. So now that we've known the major causes of high blood pressure, we will now talk about the symptoms. Like I've earlier stated, high blood pressure do not really have symptoms. You might not really know it until it has gotten to the stage that is beyond control. That is when you can, okay, it can be controlled rather, but you will not notice it until it has gotten to a very high level. So these are the signs that you should look out for. When you see these signs, know that it can be high blood pressure. Then you should rush to the hospital for a proper care to be taken immediately, because lack of proper care in high blood pressure in pregnancy can lead to another different story altogether. So the signs that you should be worried about in pregnancy when you have them are headache, dizziness, confusion. You just find yourself, you're confused over every little thing. You tend to forget things easily. Loss of sight, maybe your eyes vision will now be blurry, nose bleeding. You find yourself bleeding in pregnancy. When you notice any of these symptoms, or one or two or three of these symptoms, is something you should be worried. It should be something that you should be worried about. It might be high blood pressure. So there is need for you to quickly rush to the hospital. So now that we've dealt with the symptoms of high blood pressure, there is still good news for you. Yes, even though you have high blood pressure, there is still some proven natural means, natural remedies to this high blood pressure. The good news is that it can be lowered naturally. It can be lowered by the help of some medication. So that is why I said once you notice it, you quickly run to the hospital to go and meet your doctor. Your doctor will advise you on what to do so that it can be controlled, so that it can be lowered. So number one thing for you to do to lower the high blood pressure is always engage in rich diet food, rich diet meal. Yes, don't joke with your vegetables, don't joke with your proteinous food, and don't joke with your fruit. Always take your fruit. It will lower your blood pressure. Number two is exercise regularly. Yes, every 30 minutes of exercise every day will do you good to reduce the risk of hypertension in pregnancy. I will never stop to emphasize the importance of exercising as a pregnant person. I already have a video I made on the importance of exercise. You can check the description box for you to watch. You know what exercise can do for you as a pregnant woman. So engage in your exercise, 30 minutes of exercise every day. Another way to minimize or to reduce your blood pressure is for you to manage stress. Yes, every time always try to meditate, think, and then do not take everything that deep, because it will affect you. There are some news you just hear, you understand. So this will also help you to reduce your blood pressure. Another way is for you to limit alcohol taking. Do not engage yourself in smoking, because alcohol and cigarette are direct booster of high blood pressure. So you might want to stay away from these things when you're pregnant. Another point is engage in quality sleep, because poor sleep in pregnancy increases cortisol and high blood pressure. Please, today's video, just pardon me for the noise. This is Nigeria where there are a lot of noise, but I just want to drop this video today. If not, I would have postponed. And lastly, for the things you're supposed to do for you to reduce high blood pressure is for you to increase your intake of potassium. Food like banana, leafy green, avocado can help in the increase of your potassium. So please endeavor to look for this fruit when you're pregnant, or when you notice any of the symptoms oh God. Mind you, these lifestyle changes that I've just mentioned is not just for high blood pressure, but it's also good for you as a person. It's also good for a healthy living. So now I've mentioned the things you're supposed to do when you have high blood pressure or when you notice it, but that does not mean that you should not still see a doctor. So after practicing these lifestyle changes, there is still need for you to see your doctor. If after making all these life-changing lifestyle, you still notice that your blood pressure is above 140/90 mmHg. Your doctor might recommend you for further testing because some cases might require a bit of lifestyle changes and also prescription from your doctor. You can see she's still disturbing me. You want me to carry her, but I will shoot this video, I will post it. So in all of this, I will still have to advise and remind you that high blood pressure is not a death sentence. It can be managed, it can be controlled with early detection. So once you notice any of these symptoms, please go to your medical personnel, go to your doctor so that they can advise you on what to do. Thanks for watching and see you in my next one. Bye.